Let's now shift our attention to the other big story that we are tracking on WION, and this, of course, has to do with the COVID-19 situation in India. And India has now overtaken Brazil to again become the world's second worst affected nation in the COVID-19 pandemic. In the last 24 hours, India has again set a new record of the highest ever number of infections that have been recorded in a span of 24 hours. 168,000 infections. That is the number of infections that have been recorded in the last 24 hours. But what is worrying is not just the numbers per se, but also the positivity rate, which has quintupled in the last few weeks. And this, of course, has now taken the total number of coronavirus infections across the length and breadth of India to a staggering 13.5 million cases. The country has now surpassed Brazil, which has reported more than 13.4 million cases so far. The United States, of course, continues to remain the world leader as the worst affected nation with over 31.2 million infections. But that also has got to do with the higher rate of testing within the United States. Now, India has witnessed a very sharp uptick in the number of coronavirus infections. The country has also reported over 904 fatalities linked to COVID-19 in the last 24 hours, taking the total number of fatalities across India due to COVID-19 infections to over the 170,000 mark. The states such as Maharashtra, Kerala, Tamil Nadu and Andhra Pradesh continue to be the worst affected. This is also because of the higher rate of testing in these states, which is throwing up higher numbers of infections. Other states perhaps are not testing enough, and that is why fewer infections are recorded there. India's COVID hotspot, Maharashtra, has reported 63,000 cases of infections in the last 24 hours. The surge, of course, comes at a time after India has started its 4-day vaccination festival called Tika Utsav. More than 2.7 million vaccine doses were administered on the first day of the drive. Now, India has vaccinated more than 100 million, has administered more than 100 million doses so far. Now, with the new coronavirus variant in Brazil, the country is witnessing a massive surge in the number of COVID-19 patients who are under the age of 40 who require intensive care hospitalization. The Brazilian variant, that is known as P1, is majorly responsible for the country's COVID-19 death toll. Now, the number of people who are aged 40 and younger in intensive care units has now risen very sharply to more than 11,000 in the span of the last few weeks. This is an increase from about 14.6% of the total ICU patients early in the pandemic and a 45% surge from September last year. Now, Dr. Edelon Rezende, who is the coordinator of the Brazilian Association of Intensive Medicines, is of the opinion that the massive surge in this age group is significant because previously this was a population that typically would have developed a less severe form of disease that would not need intensive care. Previously, this was a population that would typically only develop less severe forms of the disease and would not need intensive care. So the increase for this age group is very significant. Dr. Rezende has further listed that factors that could be driving the increase. Firstly, that patients who are over 80 are largely vaccinated in the country. Secondly, young people are more likely to expose themselves to the virus because they have to leave home for work. Another factor that is actually driving the rates of infection amongst the younger population happens to be this new mutant variant of the coronavirus called P1. The P1 variant is known to be more virulent. It can reinfect people who've had the original strain of the virus. The patients arriving in ICUs now are younger and have no pre-existing conditions, but they are still developing severe cases of the virus. Brazil has registered more than 66,500 COVID-19 deaths in the month of March alone, which is double than the hard-hit country's previous monthly record in July 2020.